Welcome, everybody. I'm Neil Cavitto. And just because Congress says, thou shalt not change thy health care law, that doesn't mean that congressmen can't try. The New York Times today reporting that members of Congress are apparently baffled by this new health care law. It points to a new congressional report that finds lawmakers still don't know if they can keep their own coverage. So now it's hitting close to home. Or if they'll have to join state-run insurance exchanges like, well, everybody else, even before those exchanges are created. Or if the law applies to the leadership offices. But Congress does have an out. It is Congress, after all. It could reportedly try for a legislative fix so that it's not in a fix or simply adopt its own internal policies. I want you to think about that. So lawmakers can tinker, but you and I cannot. They can complain, but jump ugly on anyone who dares complain, like those challenging the constitutionality of all of this. They're wasting their time. Or companies who say that they're losing billions because of it. Their numbers don't add up. Republican Senator John Barrasso of Wyoming can't believe it. So why is this such a shocker, Senator? They found out they voted for something that's going to take their own precious health care away?
Well, as Nancy Pelosi said, Neil, you have to pass it before you can find out what's in it, and it is good to see Congress getting a dose of its own medicine. This bill is bad for patients, it's bad for providers, it's bad for people who are paying for it, which are the taxpayers. And if they fix this, this ought to be the last thing on the list they ought to fix. They ought to fix the fact that they're planning to cut $500 billion from our seniors on Medicare, and that they're planning to raise taxes by $500 billion.
But you know what's interesting about this, Senator? It hit home when they realized it hit home, and that their health care, and you guys enjoy enviable health care. You've told me that yourself. And it's a pretty nice package if you can have it and keep it. And apparently there are provisions in this new health care law they all signed on to that potentially could take that away, right?
Well, I think that every American ought to have access to the exact same things that members of Congress have, and ought to have those same choices. So we're going to have to see if they're going to try to make some changes, because right now it says that members of Congress can't participate in what they're doing right now, but what they have to go into apparently doesn't come into play until about 2014. And, you know, the president had said that he's willing to voluntarily be part of that in 2014. Well, I hope at that time he's no longer president, but just a private citizen.
How realistic is that, first off? I mean, for these guys to be worried enough, Senator, for them to make moves now to guarantee the coverage they have will be the coverage they keep. General Americans have no such assurances. We're told that we do, but I don't know. So if you guys were to do this, or your colleagues were to push for this, there could be holy hell erupting.
Well, and there should be. I know there are a number of us that are going to say, if you want to fix this, you better repeal the bill and replace it with something that works, something that is patient-centered, not government-centered, something that gives individual responsibility incentives, something that really focuses on the problems that we see in this country with lawsuit abuse, that allows people to buy insurance across state lines to actually get down the cost of the care. It is no surprise, Neil, that even today, people continue to be more opposed to the bill that has now been signed into law than are for it. More Americans oppose it than support it. And for the most reason, people think, hey, this wasn't done for somebody like me. The president forced this through, and the Democrats in Congress forced this through for somebody other than me.
The irony here, very quickly, Senator, is that the key argument to defend against all these AGs and governors who are trying to question the legality of forcing someone to pick up health care is that Congress essentially wants to exempt itself from being forced into this system. Hypocritical, to put it mildly.
Well, it is, and that's why I'm encouraged. I think 20 states have now joined the suit to say, we have constitutional rights as states and as individuals in our states to not be forced into this. And you know, Neil, there's another story today. There's going to be 150,000 doctor shortage over the next 15 years. There's not enough money in this bill for doctors, but there's $10 billion for IRS agents to make sure that you comply with the law, and if you don't, to make sure you pay your fine or your penalty.
I can understand why they wouldn't want to be part of that system. All right, we'll watch it, Senator. Thank you very much.
Thank you, Neil.